Good morning to all. I am Durga, working as a nursing lecturer in Emmanuel Arasar College of Nursing. Today we are discussing about pulse. Introduction is the rate of heartbeat. Pulse is actually called heart rate, the number of time heartbeats each minute. In some cases of cardiovascular disease, the heartbeat and pulse rate can differ. Definition of pulse: rhythmic expansion and recoil of arteries of body due to ventricular contraction called pulse, or rhythmical beating, vibrating or sounding. Purpose of taking pulse: to establish baseline data for subsequent evaluation. Second point is to identify whether the pulse rate is within normal range. Third one is to determine whether the pulse rhythm is regular and the volume is appropriate. The fourth one is to determine the equality of corresponding peripheral pulse or each side of the body. Sides of taking pulse: temporal, carotid, apical, brachial, radial, femoral, popliteal, dorsalis pedis, posterior tibial. These are the sides of taking pulse. Then the pulse may be felt at temporal artery over the temporal bone, carotid arteries at the side of the neck. The apical pulse is palpated to count the pulse rate in the heart. The brachial artery, the branchial artery above the elbow and in the antecubital line, inner part of the elbow, the radial artery in front of the wrist, the femoral artery in the groin, the popliteal artery in the popliteal fossa back of the knee, the dorsalis pedis artery on the foot, the posterior tibial artery behind the medial malleus. Characteristics of the pulse: rate, rhythm, volume and tension. Rate is the number of pulse beat in a minute. Rhythm: normally regular, meaning that interval between the beats equals. It's an irregular is also known as arrhythmia. Volume: the volume of pulse refers to the strength of the expansion and contraction. Normal value of pulse rate: babies under 1 year 100 to 160 beats per minute, 1 to 10 years 70 to 120 beats per minute, 10 years and adult 60 to 100 beats per minute, athletes 40 to 60 beats per minute, newborn 120 to 140 beats per minute, 3 years 19 to 100 beats per minute, 18 to 15 years 80 to 86 beats per minute, old age 40 to 100 beats per minute. Factors affecting pulse: age, gender, exercise, fever, medication, loss of blood, stress, position changes, then heart disease. These are the factors will affect the pulse. Then abnormal pulse rate or alteration in pulse rate. First one is tachycardia. A rapid heartbeat more than 100 per beat per minute is called tachycardia. Next, second one is bradycardia. A slow heartbeat less than 60 beats per minute. It's called bradycardia. These are the pulse. Thank you.